right, everybody, welcome back. Dr. Blumenthal back here in the Bethesda office with Natural Transplants, and we are psyched today. Saskia has joined us from up north a little bit in the Philly area. Thank you so much for joining us. Thank you so much for doing this video for everybody. Welcome.
Thank you.
Nervous, excited, a little bit of both. That's all right, that's normal, that's normal. If you wouldn't mind telling everybody what brings you to us and how you found us.
Well, from looking at your videos, like everyone says, I'm just here to improve the quality of my life, get back some self-esteem, some self-confidence, and just get my hair done.
Excellent. I'm going to have Kenza, again, thank you for doing this. I'm going to have Kenza join. A little bit of thinning on the left side, but for the most part, especially on the side, it's nice and thick. A little bit of loss on the top in the center portion, but the right side is really the problem area for you. From a traction standpoint, you can see the amount of loss on that side. So that's where most of our attention is going to be today. Depending on how much we get, we're going to try to fill in some of the center and maybe the top part of the left side as well too. But you, like we were talking about, you have incredible hair for this. We'll see how it's from a density standpoint, how dense it is. But I'm excited to get going. This is fantastic.
Thank you.
Yeah, this is great. So we'll do a little bit of drawing, do a little bit of shaving. We'll come back and we'll take another, check in with you in a few minutes. We'll kind of go from there.
Thank you.
Sound good? All right, we'll see you in a few. All right, everybody, we are back with Saskia, and as you can tell, we have drawn out our line. Nice natural look. We're not going to be going down all the way to the left over the ear. She's got really good density here. We're just really going to limit it to that temple. What she has decided was this would be the first priority, sort of the first two fingers all the way around, and then if we have extra, we'll fill in behind the ear as priority 2. So it just depends on how dense and how much hair we can get. Hair's beautiful. We'll see it on the density once the strip comes out. You doing all right?
I'm doing
Feeling good? We just took a Valium, hadn't quite kicked in yet, but we're going to head next door, start the procedure where all the magic happens, and we'll check in with you a little later. You good? All right, double thumbs up. Let's rock and roll. All right, we are back. Saskia, how are you?
Awesome.
You doing okay?
Yeah.
All right, we are almost done. We only probably got maybe 5 or 10 minutes left. Techs are just finishing up, making sure we didn't miss any holes. I'm excited. We got the whole thing.
Yay.
All right, so we got all of priority 1, all of priority 2. We'll kind of show the final results at the end, but I'm thrilled. I'm really excited to see the end result and see how you progress. You feeling comfortable?
Very.
Good. All right, we'll check in with you in a few.
Okay, thank you.
All right, welcome back, everybody. We are finished. Congratulations.
Thank you.
How do you feel?
Awesome.
All right.
Yes.
All right. Now be honest with everybody. I have not coached you just what to say. Tell us the good and the bad. Tell us how today went. And be honest.
To be honest,
Yeah.
the hardest part was the numbing. Yeah, that was the hardest part. But after that, I was so relaxed. And your team was so wonderful. I love them so much. You're the true heroes. They didn't do anything.
No doubt. I do not dispute that.
They did everything. I'm so grateful. I'm
Yeah.
just ready to see. I mean, just to begin the journey, and just to see what happens next. But I'm so grateful to you, to your team. Everything was perfect.
Awesome. And you were a great patient. You were just very nice and to let us do our thing. And you handled the shots well. It went very well. Once that's done, like I said, rest day was great.
Yeah.
I'm going to have Zane zoom in. I'm thrilled with the results on this. A great line on the forehead. Looks really natural. We came down, did the sort of the temple work here, and then stopped. Again, you didn't need any work down here. And we used the hair that we could have used there back here. And we had perfect amount all the way around, just past the ear. So we talked about being really careful when you sleep.
Yeah.
Have that airline neck pillow either low or just on this side. And I'm going to spin you around so we can see the incision. And that's going to be just a tiny little tiny scar, real thin, razor thin scar all the way around eventually.
Yeah.
You did it. Congratulations. Welcome to the family.
Thank you.
All right. We will check in with you tomorrow.
Okay.
Thank you so much for doing this. Hopefully this helps other people, that as it helped you. Any words of advice or encouragement for anybody out there sort of on the fence?
God. Just do it, get it done. That's all I can say.
You seem much more relaxed now than when you came in. That's great. We'll follow you along. Hopefully we can see you over the next couple months. And then, after a year or so, we'll check in and kind of hopefully do a before and after thing.
Sure.
Sound good?
Sounds
awesome.
great.
All right.
Thank you so
Be
much.
careful next couple days. We'll see you soon. All
Merry
right.
Christmas, everybody.
Thanks. Merry Christmas.
Bye.
Call us now, 844-327-4247, and ask about our Hue and Hue Plus procedures, which move more hair than ever before. Hope to hear from you soon.